My name is Esther de Gourville, and I'm the representative for the Pan American Health Organization and the World Health Organization in the Bahamas. Today marks 1 week since Hurricane Dorian made landfall in the Bahamas, and our hearts go out to the 73,000 persons who have been affected and are suffering the consequences of this hurricane. I would like to give you an update on the work that has been ongoing in the health sector with PAHO support and with the leadership of the Ministry of Health since the hurricane made landfall. To assist me, I have prepared these two charts which would help to orient us on the situation. The two affected islands are Abaco and Grand Bahama, and the capital city of the Bahamas, where 75% of the population resides, is New Providence, which is to the south of these two islands. The main affected area with the maximum damage in Abaco stretches from the area of Marsh Harbor and beyond to as far as Foxdown. In this area, more than 90% of houses have been evaluated as having been damaged by the National Emergency Management Agency, and in this area damage is much less, with only about 1% of houses affected. The areas in this area here, there is substantial flooding still, and the inability to connect populations in both north and south of the island, which is impacting on the logistical arrangements that we can make to support the response efforts. The areas in yellow mark the clinics that are known to exist on both islands, with 4 clinics roughly that have been functioning prior to the hurricane. And so far we are only really able to operate out of Marsh Harbor Clinic with some operational capacity, but not full operational capacity. In the immediate aftermath of the hurricane, some 1,400 persons sought refuge at the clinic, which impacted on the physical arrangements as well as our ability to operate in that location. Since that time, those 1,400 persons have been relocated to shelters or evacuated to New Providence, where they have either gone to relatives or to a shelter at the Kendall Isaacs Gym. At Marsh Harbor, we have running water for sanitation, but there's a problem with the availability of potable water, and there's need to do some cleaning and sanitation of the clinic. There is a generator offering electrical power, and we have had, through the Ministry of Health, several teams who have gone in to relieve the healthcare workers who were working for 4 days or so without relief in the most dire situation. So some 8 nurses and 4 doctors have gone in and are supporting the healthcare needs in Marsh Harbor Clinic. Over in Grand Bahama, has one of 2 hospitals that serve the entire country, public hospitals, and this hospital suffered flooding damage as a result of the surge and high water that occurred during the hurricane. However, there is some operational capacity at the hospital and cleanup has been done, but there's need for in-depth sanitization of the facility to make it fully functional again, and operations, surgical and other functions cannot take place at the moment. Patients in need of urgent care from Rand Hospital as well as Marsh Harbor have been airlifted to New Providence, landing at the Lyndon Pinding International Airport, and transported to the hospital at Princess Margaret Hospital here, where their healthcare needs are being addressed. Those that are in not such an urgent situation are being directed to Flamingo Gardens Clinic, where where their healthcare needs are being addressed. What has PAHO been doing in terms of the response to this situation? We have had surge capacity from our public health emergencies program in Washington, with 14 persons coming in to Nassau, but having the ability to travel to the affected islands using the logistic support of the National Emergency Management Agency and partners. Our experts cover communicable diseases, logistics, disease surveillance, and operational and coordination aspects to support the Ministry of Health in its efforts. We have been able to mobilize 5 emergency medical teams, 2 of which are fully operational on the ground in Abaco, and we expect that 1 more will be functional in Rand Memorial Hospital or near to Rand Memorial Hospital tomorrow, and 2 others should be mobilized. They're actually on their way and should be operational within days. PAHO has launched an appeal to address the healthcare needs and support the Ministry of Health and the government of the Bahamas to restore healthcare access and services. Our appeal is for $3.5 million to cover 4 essential areas. The first is to ensure that the affected population gets access to urgent health care, and that the injured and others receive psychological support as well as medical support for their conditions. The second area is related to potable water and restoring water for the populations affected. The third is in terms of sanitation and hygiene, and also vector control, because of the substantial flooding that has occurred on both islands and parts of New Providence in the immediate aftermath in New Providence of the hurricane. We would like to take preventative action to reduce the risk of occurrence of vector-borne diseases. So we do need to step up the vector control activities in the affected islands. In summary, we are really supporting the Ministry of Health in its efforts and trying to coordinate more than a dozen responding agencies that are contributing to the needs of the health sector in the Bahamas. And we hope that you will join us in providing support in this devastation that has been impacting 2 of the islands of the Bahamas.